on the News Channel 5 network. This is MorningLine with Nick Barris.
Good morning, everyone. Thanks for joining us on Morning Line. And Nick Barris here with you today on a Thursday, and we have a good show on tap. This is a live program today, and I'm here in studio, and I'll be reporting later today, so we're doing our thing here at the News Channel 5 network. But we do continue to talk about the coronavirus to get you the very latest information on it, and that's what we're going to do today. What's special about today is you're going to have a chance to call in, or we're also going to be streaming this program, as we are right now, live on Facebook, okay, at newschannel5.com. and at News Channel 5 Plus. Message us your questions, but your chance to ask questions this morning or issue comments with regard to some of the things with the coronavirus with one of the individuals that's been very much involved and part of the news conferences we've been covering every day that they've had it here in Metro, and kind of giving us the latest. There'll be another one that the mayor has insisted on having today at 9:30 with the very latest update on the number of cases and the like in Metro. But I want to say, too, what we'll talk about today obviously doesn't just apply to Nashville. Wherever you happen to be watching us today, your chance to call in and ask a question directly of one of these experts, or to message me on Facebook, or rather also on our coverage streaming live right now. Our guest this morning is Dr. Gill Wright. Good morning to you, sir. Thank you for coming on. You're Associate Medical Director with Metro Health?
That's correct.
And I know you have been very busy and involved with all of this. I want to hit you right up front right now, from yesterday to today, and I know we'll hear from the mayor again at 9:30 as we have all week long. Is there anything new at this point? Still 60 cases, though we'll probably get a new tally in Davidson County today.
Right. Still 60 as of this morning.
Okay.
We do get reporting overnight that may not have been captured in that, and we will have that updated for the press conference this morning.
Okay, and the message again.
As we've
said
right
all
now,
along,
nothing new has really changed. You know, we're happy that all of the bars and restaurants have kind of complied and helping with our social distancing, trying to keep the people of Nashville and Davidson County safe and not exposed to the virus.
I really think the message has gotten across, not just here, but in other parts of the state. I'm just curious, at what point, and I know it would not be your call, but we've seen what's happened in places like San Francisco, where they literally gave orders to, just stay home unless you just have to go out to this one place. I think most people are observing that on their own here now. Right. But if you would, make the comparison between what we're doing here now and what they are doing in, say, cities like San Francisco, which I think are a bit more restrictive.
Right. What we're doing here is not as restrictive as there. They've basically almost put in, in some places they have put in curfews and other things, and it really depends on how much are they seeing case-wise and how quickly is that growing, because everything we can do to keep people apart reduces the chance for spread, and that's what we're wanting to do right now. If I have 100 people come to the emergency room that are very sick today because of the virus that need to be admitted, that's very different than having the same 100 people come over a month's time. We overwhelm the system very quickly if we get a big spike. So what we're trying to do is reduce the interaction, so we reduce the spread, and that's what we're calling flattening the curve, and that really helps spread out the illness. Now, it may mean that the coronavirus lasts a little longer in the community, but it will be much safer for our community and the people in it, especially those that are very vulnerable with underlying medical conditions, those that are above
Sure. 60
and that type of thing.
So to get to the point where you have curfews and law enforcement may be involved like they have in San Francisco if people violate it, it would have to be where the health department reports maybe to the mayor that we're seeing more of a spike. The measures we've taken to this point are not slowing that curve, so we have to be a little more restrictive.
Yeah, if we got to that point, that's what we would have to look at those types of things.
Okay.
But at this point, we have not needed to.
Yeah,
and not taken
hopefully
that step, and hopefully we won't ever have to.
For folks, if you would tell them, and it's as it is in Metro, but let's just say someone this morning, wakes up, and we've covered this, but I want to hear it right from him, and you can hear it. Wakes up this morning and fears that they have the symptoms that appear to be that of the coronavirus. They don't know for sure.
Sure.
What do they do, and how do they go about getting a test?
Sure. So the first thing they do is that they should contact their provider, their medical provider.
Your doctor. Call
your
your doctor. Okay.
Your nurse practitioner, whoever you see routinely, and they will take and address how to go about that. First thing they're going to do is probably assess you on the phone. Do you have symptoms that are consistent with the coronavirus? Mm-hmm. If you do, they may refer you to some place to be tested. If you don't, it's allergy season. We're seeing a lot of people with a little bit of a cough, sneeze.
That's what I'm feeling. Yep.
And I've got it myself. So, you know, those are some of the same types of symptoms that people might have with the coronavirus. Mainly cough, shortness of breath, but the big one that's different is fever. So those that have fever, then that's definitely a reason to call and discuss what to do next.
As we know, there are folks who could have the virus and not have any symptoms and be carriers, and that's kind of scary because you don't know who they are. Could it get to the point where, you know, we may have enough tests where, as we've seen in some countries, you literally have the drive up, you know? I mean, if there were tests available and they said, Nick, come on down to Vandy, we've got a tent set up outside, or Metro Health, and drive through and get your test right now, I would do it. I would do it because I want to make sure, not because I fear, my biggest fear, frankly, is that I'd have it and I'd give it to someone older and it would hurt them. And I'd go do it. I wish everyone could be tested, whether you feel it or not.
Yeah. The only problem with that is that unless you currently have symptoms, you're not infectious and the virus won't show up.
So it wouldn't show up anyway.
Right. So that's why we're really trying. We don't want to, again, not only is it overloading the hospital system, you have to remember all of these labs across the country that are now running tests are getting hundreds of thousands of tests, probably on a daily basis.
But and let me
go ahead.
But when you said it wouldn't, so if I was a carrier but I'm not showing the symptoms, the test would not come back positive?
The test would show positive for you.
Okay, well that's my point then. I'm worried about the people out there that are going about their business for whatever reason, they're asymptomatic, but they're carriers. Right. And if they're not sick, they're not going in and getting tested. And heck, if I'm like that, I'm right here face to face with you right now. You're going to get it. And I would rather know, and I think everyone would like to know if they're a carrier.
Right. We are doing testing, and right now we have not had anybody that we haven't been able to do testing on. So testing is not an issue. I think that if you've been at the press conferences, they're talking about some assessment centers, something like other communities have done. At this point, they're not functional. All the details will be working out. And those will be truly assessment centers. They will assess the individuals, and in particular, they're really going to be focused on those at most risk. So those with underlying problems, that type of thing.
Triage them
and be sure that they're getting the appropriate testing and need. It may become at some point in the community, much like the flu, where it's so widespread that we're really not doing testing on everybody, because it's very highly likely that it will be positive, and then we'll change how we're doing approach there.
All right, what we're going to do is we've got a lot of calls and comments coming in. Just as we go to the break, I'm going to throw this out and let you answer it. If we should take some solace in this, provided, again, it's coming from Chinese authorities, and sometimes you wonder how credible that is all the time, but we're hearing that in Hunan, you know, as of yesterday, no new cases. And it's because they're following, or had done this exact protocol that we're doing now, and hopefully that gives us hope. We can talk about that also. Those of you on hold, get to this. If you can keep your questions quick, I'm going to let as many of you talk to him as possible. And also, if you want to message us from Facebook, or if newschannel5.com or News Channel 5 Plus. I was just looking down here. We have someone watching from Switzerland. How are things going in Switzerland, Nathalie? Let us know. Listen, we'll take a break and be back with much more with Dr. Gill Wright and the coronavirus right after this.